I'm interested in is, why do you think there's so many differences of opinions or like controversies regarding stem cell therapy around the world? Like if you talk to someone a doctor in the UK, for example, most of them will say no, it's a myth, and you should never do. Like you talk about PRP and people get confused. And I'm just in the UK, and that's not around the world. Why do you think there's so many differences of opinions and like controversies around like stem cell therapy, especially for orthopedic conditions?
I think there's a lot of confusion because of terminology. I think a lot of things get brought under the regenerative medicine banner. I think a lot of things get put under the stem cell banner inappropriately. And I see a number of patients who say, I have had stem cell therapy, and what they have had is platelet-rich plasma, which can be a very good biological cell-based therapy, but it's not stem cell therapy. And what we expect from PRP is very different to, say, what we expect from mesenchymal stem cell therapy, whether they're doing a same-day procedure or, an isolated, expanded cell preparation, which is very different. There's an enormous amount of confusion out there. That does make it really complex for general clinicians and surgeons to try and decipher all the information out there and what's relevant, what's not relevant, what has efficacy, what doesn't have efficacy. So it's not clear for patients, and it's not clear for most clinicians. I think that's where the difficulty is. Also, unfortunately, a big commercial drive in some practices, and therefore they're really looking at information which supports their dialogue.
Yeah.
And it may not be actually representative of what they do. I think patients have to ask the right questions. They have to have a platform like yours, which actually advises them on what questions to ask, where there are good regulations. So whether it might be tightly regulated, but that actually encourages or enforces safe treatment. As I said, the real priority at the start is to cause no harm. So having safe treatment and then also showing that it's efficacious.